Does sex hurt? Pain during intercourse, known as dyspareunia, is more common than you might realize. Dyspareunia is persistent pain before, during, or after intercourse. It might feel like burning, sharp discomfort, or a deep aching pain. While this condition is physical in nature, it also carries mental, emotional, and relational effects. If you're experiencing this, you can get better. Some common culprits of dyspareunia are pelvic floor dysfunction, like muscle strength and coordination deficits, hormonal changes that cause vaginal dryness during perimenopause, menopause, or postpartum, hello lube, medical conditions like endometriosis, infections, or past surgeries, and psychological factors, including anxiety, past trauma, or stress. So how can dyspareunia affect partnership? Well, many people feel frustration, sadness, or even guilt about experiencing dyspareunia or avoiding intimacy due to the pain. Partners may feel confused or helpless, unsure of how to support their loved one. And over time, dyspareunia can lead to relationship stress, reduced intimacy, and even anxiety around physical closeness. But understanding that this is a medical condition and you can get better is the first step toward healing. The good news? Pelvic floor therapy is a highly effective treatment for many people experiencing dyspareunia. A pelvic floor therapist will help identify muscle tone, strength, or coordination issues that may be causing or contributing to your pain. A pelvic floor therapist should also address habits, routines, and roles around sex, peeing, and pooping that could be contributing to pain. They'll provide an evaluation, education, and treatment techniques to help with your individual situation. An external and internal pelvic exam are part of a pelvic floor evaluation. An internal pelvic exam consists of a gloved, lubricated finger inserted intravaginally. We are assessing for any tender areas that feel tender, bad, neutral, good, around the pelvic floor area. This allows us also to assess that deeper layer of pelvic floor muscles. So I'll have you contract and relax to assess for muscle coordination, tone, and strength. So a couple things to try at home yourself. First, switch it up. Try different positions like side lying. Second, make sure you're warmed up before engaging in sex. What that can mean is performing a gentle massage around the vaginal area, around the vaginal opening. So 1 or 2 fingers on the tissue around the vaginal opening, just gentle circles. You can perform this, your partner can perform this, and make sure you're breathing and performing this slowly. This will help warm up the tissues for penetrative sex. Many people notice significant improvements in their pain, comfort, and overall well-being with consistent therapy. And for couples, pelvic floor therapy can restore confidence and closeness in their relationship. If you're experiencing pain during intercourse, know that you're not alone and that help is available. Pelvic floor therapy can be life-changing, improving not just intimacy, but overall quality of life. Your comfort, health, and happiness matter. Don't wait to seek the support that you deserve.
Thanks for watching. If you want the real uncensored scoop on all things pelvic and sexual health, join me on Patreon. You know, in case YouTube thinks my content is a little too spicy. Let's learn, laugh, and get real about your private parts together. See you next time.